Red Cross has been training community disaster response teams since the late 1990s. The Jamaica Red Cross, during the year 1998 to 2000, started training CDRTs as part of the regional community-based disaster preparedness programs. The members were trained as Red Cross teams in disaster preparedness. The aim was to ensure that the most vulnerable was reached during an emergency.
Disaster management has been a big issue in the region for the last decades. And in 1998, when we started looking at how we could address better disaster preparedness and disaster response, we really look at how we can access to the most vulnerable and isolated people in the region. This was very important in terms of when you have hurricanes or floods, the first thing that happens is that you have a big isolation of communities, where it's very difficult for responders to reach them. So sometimes it may get a couple of hours, but it can also be a couple of days before you can really reach them. So in 1998, we started looking at different possibilities of having a better response to these situations. I remember when we were working with the Jamaican Red Cross from 1998 to 2000, how this was looking at the communities and organizing themselves so that they could really respond to that. This was the beginning of what we're calling now community response teams. It was an interesting experience in terms of, for the first time, giving the voice to the communities to really do it and empowering them with skills, with tools and materials so that they could be the first responders at the time.
This replication process continued over the years throughout the different DPECO programs in the region, but this did not come without its own challenges. There was a learning curve on the methodologies used and how best to encapsulate knowledge and sharing it throughout this new network of collaborators.
One of the big conclusions that we had from that time was that the core of the disaster response needed to be based on communities. And the mechanism that was put in place was really a mechanism at the beginning that was pure Red Cross mechanism. So these teams that were set up in Jamaica and in other countries in the region, like Grenada or St. Lucia, were really Red Cross systems. Of course, this experience that we had harmonizing and setting up this community response team was not without issue. We learned a lot from that time because there were duplications that were happening between different types of systems in the country, either with governments and national disaster offices setting up their own national disaster management system to respond to the needs of their population, but also from other actors who were developing health teams, developing other types of teams to respond. So it was an interesting period because the reflection we got from there was, yes, this is a necessity and it's working, but we need further integration and further discussion and dialogue on how we can move forward in this time.
During the period 2010 to 2015, there began a process of transitioning these groups from Red Cross teams towards community-based teams that are integrated into the disaster management national systems. This has led to the recognition by national disaster offices of the importance of community teams, an increase in the number of trained CDRTs and CERTs across the region, and issues involving recognition of teams.
The CDRTs are Red Cross eyes and ears on the ground where we do not have Red Cross branches. Even though they are essentially part of the community, because they've been trained by Red Cross, they feel they are part of Red Cross. So we would generally alert them if there's any hazard pending. And we also ask them to report to us post-impact on their individual situation, because sometimes, oftentimes in fact, they may become isolated and we may not have contact with them. So we, even after the training is over, we do maintain contact with them.
With the CDRT team, they are part of the disaster committee in the community. So some of the members here are part of the general body. And so in the event of a disaster, especially during TS Erika, they were able to respond immediately because we had flooding, block drains, and they were able to come out. We had a few landslides. They were able to come out and use, the different equipments that were given under the Deep Echo 6 project through Red Cross, and they were able to use that, clear the drains, and so the community came back to normalcy.
Where we have CDRTs after TS Erika, we were able to utilize them to do the damage and needs assessment. Also, when we drop based on the data and we drop our beneficiary list, we will validate the beneficiary list with the CDRTs that comprise part of the disaster committee. So they're a useful body to have in the community when validating information.
The success of training CDRTs requires strong partnerships between the Red Cross and other national agencies. In Antigua and Barbuda, the National Red Cross Society and the National Office of Disaster Services has been working closely with vulnerable communities and conducting refresher CDRT trainings. This forms part of the American Red Cross Saving Lives in the Caribbean project through funding from the USAID OFDA. Director of the National Office of Disaster Services, Mr. Fillmore Mullin, believes that such collaborations with the Red Cross is very important and is keen to see the outcome of the standardization of the CERT and the CDRT programs. He also noted that over the years, the need for more sustainable engagement at all levels, impressing on volunteers to be drivers of their own community initiatives so as not to lose momentum. Mr. Mullin stressed the need to engage more youths as key socially responsible contributors to society.
It's not necessarily true that young people are all bad.
True.
There's a significant amount of good young people, and we need to ensure we use them to be examples for those who might want to be otherwise. So we've given them a very short list of engagement in terms of some kind of recruitment, and that they should start to utilize the material that is left behind and do some training. You don't necessarily have to be a formal training session, but what that will do by introducing the material to their peers, it also helps to build their confidence in terms of understanding the material and being able to put it over. And to set up a limited schedule of how often they'll meet, what they'll do when they meet, and I've asked them to either contact myself or Red Cross for guidance where this is concerned. Because if you bring these young people into the fray and you don't keep them engaged, you're going to lose them.
Many CDRTs over the years have struggled to remain active and visible in their communities. According to some CDRT teams, the infrequency of their response to emergencies has contributed to members losing momentum and the group becoming dormant. But there are several success stories of CDRT groups that have remained active from its inception. Some CDRT leaders attributed the sustainability of their groups to keeping persons motivated, having regular meetings, hosting community engagement activities, as well as team building that included social activities outside of the scope of work.
My name is Jerome Toussaint from Calibishi. I'm the leader of the CDRT team in Calibishi. We got organized in the 2008, and our group is a vibrant group. We have been working throughout the community for the past times. We try to get the community aware of the group by having some assimilation exercises. There was once we organized a sports day and have everybody come together, and at the end of it we had some assimilation exercises and the people aware of our group existence in the community. We keep meeting regularly enough to really keep us going. Whenever there is a disaster, our presence is seen and felt in the community. And I'm very happy about our group. We started our group for about 24, and it's growing now. It's about 30 of us in the group right now.
Another opportunity I see, if this group remains focused, all the trainings that they get, we plan to source funding to do many projects in the community. As I indicated earlier, Calibishi is a low-lying area and it is vulnerable to some storm surge, flooding, landslide. So if this team remains how they are, vibrant as they are, I see we have a good future in Calibishi.
What is the future of these communities in terms of climate change, in terms of the changes that we're having in economic and social issues in the country? I think that we need to listen to that, and we need to really integrate into the perspective into the future and see how we can evolve into a more safer and resilient communities in the Caribbean.